Good morning, everyone. My name is Fred Carnes, and I am the President and CEO of St. Luke's Health Initiatives, and I'm especially pleased to be here with you, and I want to thank Doug Tarrant and the University of Arizona Public Health Training Center for being our partner in this effort. We're really glad to be able to work with them to bring this day together for you all. It's no secret to anybody in this room, for sure, that this meeting comes at a critical time when the dramatic changes are underway in affecting health and public health across the country and the health system in general. And what we all know, of course, is that no matter what the Supreme Court decides or what the next election decides, the healthcare delivery system is going to change. And we know that an absolutely essential component of that system is the public health sector. So as change swirls about us, I think it's we can either be casualties of that change, or we can come together like we are today and make sure that change is accomplished in a way that benefits the people that we're endeavoring to serve. So I'm particularly glad to be here today with all of you. Some of you know I'm fairly new to St. Luke's, having been in Washington, D.C. for the last 3 years. And as you sit out there, I'm sure you're saying, that's why he's wearing a dark suit in June, and I need to change out of my Washington wardrobe. But one of the roles I played while I was in Washington was to be HUD Secretary Donovan's designee on the National Prevention Council. And for someone like myself who spent most of my career working with vulnerable populations, but really through the lens of housing and community development, it was an opportunity for me to sort of see the world through the public health lens. And along with the other 16 federal departments that were part of the development of the National Prevention Strategy, I think we began to better understand, all of us that weren't part of the public health world, the important role of interdisciplinary population health approach that's been the cornerstone of your philosophy for many decades. And as a result, I think, of this understanding, what happened was one of the key recommendations that came out of that strategy was to make sure that the public health sector was both embraced and lifted up in the work that we do around prevention. So today, to make sure that we're ready for an ongoing discussion about healthcare reform or national prevention strategy and how public health fits into all of these things and how it fits here in the community. Obviously, there's lots of conversations going on around the country, and we need to make sure that public health is in the center of that conversation. So as we jump into the topic this morning, we'll be hearing from a lot of great panelists, and they'll all be introduced in a little while. But I do, however, want to say a special thank you to Robert Pestronk, who's here from is the Executive Director of the National Association of County and City Health Officials, and has come here today to be with us, and we're really thankful that you could join us today. Before I sit down and get the agenda rolling here, I'd be remiss if I didn't thank the steering committee who helped put this together. So if you're here, at least raise your hands when I call your name. Jennifer Benet, the Executive Director of the Arizona Public Health Association. I know she's here somewhere. There she is, right in the middle. Janet Mullen, Deputy Director of the Arizona Department of Health Services, back over here. Sheila Scholander, Assistant Director, Public Health Prevention Services, Division of Public Health Services at the Arizona Department of Health Services, and Carol Vack, the Local Health Liaison and Public Information Officer for the Arizona Department of Health Services. And finally, and last but certainly not least, I want to recognize the great work of my colleague, Kim VanPelt, the exceptional director of our policy center called Arizona Health Futures at St. Luke's Health Initiative. She's been at the center of the report that was pulled together by several of you, and also been very much a part of this meeting. So I want to thank Kim for her great work on this, and also Megan Bearden, who's outside, our staff person, who's helped put this together also. I'm going to ask Kim to come up here and talk a little bit about, give us an overview of some of the trends that she sees occurring in the public health sector here at the state level. But as she comes up, I want to remind you that if you are seeking to register for CEUs for this event, you need to track Kim down maybe at lunchtime and make sure that's taken care of. So Kim, come on up, and thank you again. Thank you all. I look forward to being with you all day.
So thanks, Fred. Good morning, everyone. So I'm really thrilled to see so many of our leaders in public health around the tables this morning to talk about how our healthcare system in Arizona and public health is changing. and how we might work together to navigate the changes and challenges ahead. Much of what I'm going to talk about today comes from a report that SLHI issued this last December describing changes in the landscape for public health and the challenges and opportunities resulting from those shifts. The report looked at what is happening at both a state and national level, and I know I interviewed a whole bunch of the folks in this room for the report, as well as folks nationally who are public health experts. As part of our research, we looked at changes in budgets, changes in programs that are occurring, best practices that are occurring across the country, and we really wanted to get a better understanding of the trends and possibilities that lie ahead for public health. So as I prepared for today's presentation, I realized that a lot's changed since we issued our report. Certainly the legislature has passed another budget. There have been additional cuts at a national level to public health funding. The Department of Health Services has announced some new initiatives to address some of the very opportunities that were described in our report. Locally, the Maricopa County Department of Public Health has been engaging in a community needs assessment. And just recently, there's been a whole bunch of announcements of some new grant opportunities for public health. And in the next week or two, as Fred mentioned, we're going to learn a lot more about the future of healthcare reform as the Supreme Court renders its decision. So I decided to use this slide on the screen today because I think it really exemplifies what's happening right now. I've used this slide before, so for those of you who've seen it, I apologize, but I really wanted to emphasize that I think that we're right now in the midst of just enormous change that's occurring both at the state and national level as it pertains to health. The health sector is changing just at a mind-boggling speed. And as Fred mentioned, regardless of whether the Affordable Care Act continues or not, the speed of change is really not likely to change anytime soon. So in the words of that eminent philosopher, Yogi Berra, the future just ain't what it used to be. And to paraphrase one of my other favorite philosophers, Ferris Bueller, life moves pretty fast. And sometimes you just have to stop and look around, or you'll miss what's happening. So that's what I'm hoping we can do today, is really just stop and think about what's happening in the world of public health and have a conversation about what do these changes mean, how can we work together more effectively, what's happening on the road ahead. So for most of you in the room, what I'm about to read is simply a no-brainer. It's what you know, it's what you live, it's what you do. But I think it's nonetheless worth reading since it so eloquently describes why our conversation about the future of public health is so important and why all of us, whether or not we consider our work to be in the realm of public health, should be concerned about the future of public health in our state. More than 20 years ago, the Institute of Medicine defined public health as an organized community effort aimed at the prevention of disease and the promotion of health, with a central mission of fulfilling society's interest in people being healthy. So I think this definition is an aspirational vision for public health. It reminds us of how much more work needs to be done to fulfill that vision. I think few of us would characterize public health efforts in our community as being broad-based. And with nearly 3/4 of our health system's costs being attributable to chronic disease, many of which are preventable, we have a long way to go before public health's mission is achieved in this country. It's also important, I think, to reflect just for a few moments on the importance of public health in the broader scheme of our healthcare system. More often than not, when you hear about our healthcare system in the media, you hear about issues such as coverage or healthcare delivery system. They really get all the attention. But what we know, what we all know, is that our health is affected by a lot more than whether we see a doctor or whether or not we have health insurance. The chart that you see up here was developed by the Robert Wood Johnson Foundation. They convened a number of health experts and really looked at the research about what affects health. And what they did is they outlined essentially the health factors that affect individual health and assigned weights to their relative importance. And we can argue whether or not we agree with the weights that they assign. The point here is simply that health is mostly influenced by what happens beyond the walls of a hospital or a doctor's office. It happens in the broader community where public health operates. Yet despite the importance of public health to our individual and population health and to bending the cost curve in this country, resources devoted to public health are in many instances declining. For example, in our report last December, we looked at total funding for public health at the Arizona Department of Health Services over a 3-year period from 2008 to 2011. And we saw a precipitous decline in funding, primarily in the area of state appropriations, which is exemplified by the red portion of the bar charts that you see on the screen. Indeed, what we saw is that during a 3-year time period that we reviewed, state funding for public health through the Department of Health Services declined by a whopping 68%. And while this fact in itself is somewhat daunting, it's really critical to put it in the proper context. As one administrator we interviewed for our report said, it's not the recent cuts that are causing the problem, it's the pitiful place where we started to begin with. So, as many of you know and repeat time and time again, funding for public health has never been a strong point for the state of Arizona. Our state spends roughly half of what other states spend per capita on public health, $48 versus $94 nationally. And the dollars spent vary widely depending on where you live. Due to the ways in which public health funding are cobbled together between state and local dollars, funding for public health varies fairly dramatically by geography in our state, with funding per capita for Maricopa County, Pima County, and Santa Cruz trailing the other localities. While limited funding for public health in this state is nothing new, what is new and different is that the trend is now occurring where we're seeing cuts to federal funding for health care and public health. In recent years, the federal government has been filling many of the holes in our public health care system. So, for example, in response to the bioterrorism scare of more than a decade ago, there was an infusion of dollars at the state level that were dedicated to emergency preparedness and surveillance that really helped strengthen our public health system. In more recent times, we saw an infusion of federal dollars as part of stimulus packages that were aimed at prevention. But in many instances, those dollars are now evaporating, and we're seeing a real decline in how much federal funding our state's receiving, as exemplified by the graph. And with the advent of healthcare reform, I think there was a real hope that there was going to be this newfound era of emphasis on public health. And in the beginning, there was this noteworthy infusion of dollars as part of the legislation, $34 billion over 10 years, that was to be directed to public health. And indeed, a lot of that money is strengthening public health across the nation, providing dollars for investments in the health infrastructure at the state and community level, and investing dollars in local communities, such as grant opportunities through community transformation grants. However, the promise of this investment dimmed almost as soon as the legislation was signed. Since the law went into effect, Congress has continued to chip away at the dollars through this fund, and has even threatened to do away with the fund in its entirety. So, given these changes and given to the tightening constraints on public health funding, how is the public health sector in Arizona responding to these changes? Well, in many instances, I have to say that when we interviewed folks and talked to them about their experiences, we were just really impressed by the ingenuity and creativity of the public health sector. Oftentimes, there are just new ways of doing business and new creativity to address the shortfalls and the stretched resources. So, for example, local health departments shifted money used for tobacco education in school settings back to the Department of Health Services. The department's now using the money more cost effectively to educate teenagers through social media. Just one of many, many examples of using some creativity to address the problem with constrained resources. Another way that we're seeing the public health community address the challenges of limited funding is through grant seeking. We're seeing a lot of local health departments actively pursue grants. One example is through First Things First. There's been a lot of grant opportunities for First Things First, and local health departments have certainly been going after those dollars and receiving those dollars and engaging in new activities such as home visitation programs. County health departments are also collaborating among each other in new ways in this era of restrained resources. For example, epidemiologists at 3 local health departments, Graham, Greenlee, and Gila, are now working together to share just one epidemiologist. There also seems to be increased scrutiny on what works. There's a newfound review of really looking at best practice and trying to really focus on those programs to yield both better outcomes and to make better programmatic and funding decisions. So while many of the changes I just described are really positive and really exemplify the creativity of the public health sector, I'd really be a Pollyanna if I said everything was just great out there, because it's not. Many of those we interviewed expressed some real worry about some of the changes that they're seeing in the public health sector. For example, when they talked about the increased reliance on grants, many of the people we interviewed talked about how they're afraid that some of the core health services that public health has really been relied on to deliver may not be getting the attention they need. An example is follow-up on communicable diseases. And the reality is that private dollars just really aren't there to fund those types of activities. Another effect of the decline in funding is decreased staffing and capacity at the Department of Health Services. I was at ADHS a couple weeks ago, and I have to say, I used to work there, having walked into the building, you are really struck by how empty the building feels these days. There's just not as many folks there, and it doesn't take a rocket scientist to quickly figure out that there's just been some enormous changes in the staffing. Some of these changes are really resulting in county health departments having to do more on their own. Sometimes that's a good thing, but sometimes it really just doesn't make sense. An example of that is in our interviews, we talked to county health officials who talked about now having to build capacity to do testing for things like STDs and West Nile virus, et cetera, when the reality is we have this fabulous, great state lab that was built a decade ago, and we really, we need to be putting resources into that. The changes that are affecting public health go beyond just constrained resources, however. They also include new expectations for the sector in general. For example, I mentioned before that federal dollars are being cut in a variety of areas, such as emergency preparedness. However, the federal expectations about what states are supposed to do certainly have not diminished. We still have to do the planning and the preparedness exercises and the surveillance that we were expected to do. And the unfortunate thing is we just don't have the same level of resources from the federal level to support it. There's also beginning to be a movement in this country for public health departments to seek and achieve a newly created national voluntary accreditation status, which in turn is defining what is expected of public health. While accreditation offers many promises, which I will talk about in a few moments, it is hardly a cakewalk for county health departments to achieve. And it also potentially poses some challenges for the guarantee of public or private funding. There's the potential that essentially it could be tied to accreditation status, or at least enhanced funding in the future could somehow be tied to accreditation status. So simply put, the expectations for public health are not getting any easier. The public health system is not only changing in response to budget cuts, it's also changing due to new federal priorities. So an example of this is that nearly a quarter of CDC dollars are now being awarded to states that are targeted to what CDC Director Frieden has deemed the winnable battles, and they're listed on the screen. So because of this, it's no accident, for example, that I now see when I look at the Department of Health Services strategic plan that there's a great emphasis on these winnable battles. Will Humble is certainly no dummy. Another trend that stood out as we conducted our research for our report was the increased competition that's occurring for those national dollars, either federal dollars or national foundation dollars. As I mentioned before, there are many new opportunities for funding for public health contained in the Affordable Care Act. And despite some of the recent chipping away of the dollars, there's lots of grant opportunities that await. However, the reality is the competition for those dollars is pretty stiff. This chart here shows how Arizona essentially is faring compared to some neighborhood states in receipt of dollars through the Affordable Care Act for public health. And as you can see, we're trailing many of our neighbors in drawing down those federal dollars. At the time of this analysis, we had received about the same number of dollars as the state of New Mexico, who is about a third of our state's population. And we did a similar analysis looking at states of comparable size to ours, and we also found that our state is lagging behind in drawing down those federal dollars. So other changes and trends are also occurring on the federal front. Increasingly, both public and private dollars are emphasizing a focus on local communities like never before. For states like Arizona to be competitive, it would seem that there needs to be an emphasis in this area. National funding opportunities, both public and private, are also emphasizing collaborative, multi-sector approaches to improving health. Some of this flows from the national prevention strategy that Fred mentioned, but many of us recognize that this trend has basically been occurring for some time. And it's a trend that recognizes that systems approaches need to be implemented for community health to truly improve. In my conversations with public health officials, many noted how examples of sustained multi-sector collaborations are pretty rare in Arizona. What more often seems to be the case is that there's some great new grant opportunity where everybody scrambles to be part of it and act as a partner. And it's a struggle to really exemplify or to document how folks have been working together for a sustained period of time with great outcomes. Many of those I interviewed noted that efforts to establish this kind of multi-sector collaborative approach to addressing health take time, dedication, and resources. There's also a shift nationally occurring towards taking a whole health approach to improving health, which is essentially really a cornerstone of healthcare reform. It's looking at how care can be coordinated for people, how people can receive a full array of services, and how they can not only have a personal physician, but also get the preventive health services they need in the community and the social and emotional supports that they need. This vision of whole health and the corresponding pilots and demonstrations that are contained in healthcare reform to support medical and health homes, chronic disease management efforts, and community-based services and enhanced primary care envision new types of partnerships essentially between the medical sector and the public health sector that really just doesn't exist in the state. Of course, collaborations and coalition building can only get you so far if the fundamentals of public health, the core services, are just not there. And it's difficult to build a body of work, achieve successful outcomes, and attract those grant dollars for your work if you're underfunded to begin with. So one of the folks we interviewed have probably my favorite quote. And he said, you know, you just can't write a sexy grant application if we say we're so poor that we suck at everything. So, you know, I think that's really a grounding quote because it really makes you think about, you know, we can only ask so much of public health if we don't put the resources into it, right? So what does this mean? Well, it really means that we have to address the need for funding for public health in this state and preserve and protect federal funding for public health in general, especially for core services. And unfortunately, all the evidence seems to suggest that that's going to be really hard to do in the future. I don't see the state putting any more money into public health anytime soon. And certainly with our huge federal budget deficit, you know, there's just more talk about cutting as opposed to adding resources at this point in time. So Arizonans and those who care about public health in particular need to make the case for public funding more than ever before. We need to emphasize the importance of public health and the role that it plays in achieving good health outcomes and controlling costs. We need to build partnerships with business and others who can advocate effectively for public health. And we need to aggressively pursue those national funding opportunities if and when they meet our state and local health needs and priorities. National voluntary health accreditation, I believe, provides both a carrot and a stick for adequate funding for public health. To achieve and maintain accreditation, local health departments will have to show that they have adequate capacity to address core public health needs in the community. When public health capacity is lacking, it may be easier to make the case for additional funding given that there's some demonstrated measurable standard in which to measure yourself against. And accreditation also provides an incentive for at least some core support for public funding, since it may in the future be tied to the receipt of dollars at a national level. So I believe the fundamental challenge and opportunity ahead for public health is in its ability to mobilize community partnerships and actions to solve health problems. This is essentially one of the essential public health functions that are commonly referred to by people working in the sector. As I noted before, emphasis on accreditation, local health, multi-sector efforts, and the integration of health will make the need for collaboration more important than ever. There is also a potential for county health departments to partner with others, such as hospitals and community health centers, to conduct community needs assessments and planning, something they all must do individually, but which are rarely done collectively. There are opportunities ahead to continue to think about how resources and expertise might be shared by the state and local jurisdictions during a time of constricting resources. Just yesterday, I heard about a new RWJ grant, for example, that offers funding for states to explore just such collaborations. There are opportunities to rethink, restructure, and get strategic. During our report research, we interviewed the head of one local health department in another state who the Robert Wood Johnson Foundation deemed as sort of a healthcare leader and someone who's really making big changes at a local health level. And he really talked about how he was using accreditation as an opportunity to get really strategic and think about what were the priorities for his local health department. And he was making dramatic changes, essentially, in both staffing and programming based on those priorities and based on really the priorities that he was identifying through the accreditation process. There are also opportunities, I think, to build partnerships across sectors and break down silos. There's a window of opportunity right now through healthcare reform to really start thinking about how lots of different folks are reaching out and trying to build partnerships. We see this happening with hospitals right now. We see it happening with insurers. It's happening as folks are trying to prevent hospital readmissions, so there's a newfound need for partnerships with housing, with community providers, with social service providers. And there's really a role, I think, for public health to play in all of this. It's the idea of keeping people out of hospitals, keeping them in the community, keeping them healthy. And so if you really think about it, there are lots of folks right now have a newfound interest in public health that I think just hasn't existed before. And I think this is the golden moment. In short, this really is the time and the opportunity right now to make the case that public health is everyone's business. I think we also have a really golden opportunity right now to put increased emphasis on public health's role in shaping policy. This, again, is another of the 10 essential public health functions that folks commonly refer to. One of our interviews with a public health expert emphasized the irony that, when you cut staff and you cut programs, sort of ironically, you have more freedom to actually think about things like systems and policy that you may not have had time or energy to devote to before. And so there are some opportunities here to have a renewed focus on policy. And if you think about it, a lot of the opportunities and changes that we've seen and strengthening of public health really have come through policy change. Think about changes, for example, at the ballot initiative related to tobacco and the impact that's had on the public's health. As one public expert noted, there's really this transition right now in public health and prevention from thinking about programs and sort of one-on-one interventions to thinking about communities, thinking about systems, thinking about policy. Again, this is a big shift for public health. It's not that they haven't been there before, but I think there's really the time and opportunity for a renewed emphasis in this area. In closing, I'm going to end where I began, which is simply to say that health, like politics, is local, and we right now have this tremendous changing healthcare landscape in this country and tremendous changes that are occurring in the area of public health. In the next couple of weeks, the Supreme Court's going to render its decision on health reform, and none of us really know what they're going to say and what the impact of that might be. But the reality is that the impact on public health in some ways doesn't matter because the imperative really is there regardless of whether the law exists or not, for there to be real change in terms of how community health occurs. And I think a lot of folks argue that for true healthcare reform to occur in this country, it's not dependent on a federal law. It's dependent on what happens in local communities. It depends on the partnerships and how we essentially change how healthcare is delivered, how we make sure people stay healthy, how we make sure people stay outside of the hospital unless they need to be there. It depends on how well communities are able to organize around these goals, getting back to that original definition from the Institute of Medicine. How do we organize as a community? Public health can and should play, I would argue, a leadership role in all this. It is part of the definition of public health, and I think it's really what needs to be happening for true healthcare reform to occur. So thank you.